Dr. Dooley, board certified psychiatrist practicing in Georgia. I'm just taking a little bit of a break. I'm gonna try to get out here and get some of these leaves cleaned up in our yard this morning. A patient told me about an interaction they had had with a doctor, a new doctor. And the patient I was talking to was in a larger body and has really done a lot of work around managing her eating disorder, to eat intuitively and to really care for her body, and has done really well. And upon first meeting this person, the doctor looked at her body, made assumptions, and started giving her advice to lose weight, advice about changing her dietary habits, when he was totally off base and off kilter about what kind of food she eats and what kind of activity she has. So he didn't even ask, he just looked at her body and made an assumption. When I thought more about it, one of the things that pissed me off is that I saw myself in that old behavior. So I saw that I used to have a lot of internalized fat phobia, and I am sure that it came out stigmatizing people who were in larger bodies. And so I think that is so true, that when we are angry or touched by something, we have a personal connection to it. And that's really what I felt. I'm like, oh, I'm being judgmental, but really it's because I used to have some of those same behaviors. And so I want to give patients a couple of tips and also a challenge to doctors this morning. So my kind of first tip to patients: if you're living in an average or larger size body, a body that people wouldn't automatically assume, like stereotypically, would have an eating disorder, if you're seeing a new provider, please be open about that. I know that it's hard and people feel judged or like they may not be believed if they're not underweight, that people may not believe that they have an eating disorder. But it is important to communicate, particularly if you've been given a specific diagnosis. Then please do share that with the provider when you go in. At least the person will have a responsibility to review that, and hopefully they will be curious enough to at least ask you some questions about your eating disorder. The second thing is, just know that when you as a patient go to a doctor's office, you are consenting for the things that happen there. So when we have, let's say, a surgery or a procedure, we're used to having a consent form, right? We read it, we sign it, we say we agree with the risk and the benefits. But we don't often think about that when we go to just like a regular doctor's office visit and they're doing things like taking our blood pressure and being weighed. So even though we're not asked directly if we want those things to happen, it's kind of implied that we're giving consent for those. But as you know, people who've had disordered eating or are struggling with eating disorders often can be very triggered and emotionally kind of disrupted when they're weighed, or when people talk to them about things like BMI and the latter. So you have a right to decline to be weighed, or you also have a right to ask for a blind weight. And a blind weight could be weighing backwards so you don't see the number on the scale, or weighing with your eyes closed and asking the nurse or the medical assistant not to tell you what your weight was. Or you can just decline to be weighed. If you feel like it may be too triggering or if it may be emotionally harmful to you, you can also decline to be weighed. And I hope that my physicians and other medical providers who may be watching this aren't exploding, because how we often see numbers and how we're trained to see numbers is in an objective fashion. But what we don't realize is that those numbers can be stigmatizing to people, and it can be triggering to people. So even if we feel like we absolutely have to have that information to calculate BMI or to have other health-related conversation, I would really challenge the providers today to think about that. Do you absolutely have to know a person's weight to talk to them about their insulin and their high blood pressure medication? Not really. I mean, I see patients and I can have whole appointments and not have to know what the person's weight is. It's often not relevant to the specific conversation. So I would challenge healthcare providers to be very mindful about that, and to also respect people's wishes if they ask for a blind weight or if they ask not to be weighed. So I want to challenge you not to make assumptions about people's health just based on the size of the body they're in. Don't assume that they're not active and they're not engaged in physical activity. And I will also challenge healthcare providers to give your recommendations in a weight neutral fashion. So for example, if you want to talk to a patient about lifestyle factors like exercise, you can talk about exercise, and it doesn't have to have anything to do with losing weight. Like, you can talk about yoga, you can talk about running, you can talk about all these activities, and they don't have to have anything to do with losing weight. You can talk about making dietary changes to address triglycerides, for example, and it doesn't have to deal with weight. There are just so many aspects of healthcare that we can talk about that don't involve us losing weight. Well, that's all for me. I'm gonna get this work done here before it starts raining, and you all enjoy the rest of your weekend. I'll be back soon.